Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today series of epidemiology to be completed. Fourth part of the series that describes the principles of prevention and control of infectious diseases include risk factors, a disease meanings, natural history of a disease, seasonal diseases, with complete discussion and examples. Risk factors: as animals and or humans, pathogenic genome, environmental cases as locality and seasons, all of them in epidemiology known as a risk factor, which is a variable associated with an increased risk of disease or infection. Determinant is often used as another synonym of risk factors due to a lack of harmonization across several epidemiological disciplines. In its more widely accepted scientific meaning, in epidemiology, risk factor and determinants are the same faces for the one coin. Determinant specific to community health policy is a health risk that is general, abstract, pertain to inequalities, and is difficult for an individual to control. For examples, occurrence of 4 epidemics from lumpy skin disease in Egypt at years of 1989, 2006, 2012, and 2018 due to several risk factors or due to several determinants like lack of community knowledge and education of owners, lack of vaccination shot that cover all the number of the cattle in the country, and reporting of several cases of vaccination failure during massive vaccination of animals all over the country. So, several single cases were reported to occur between the 4 epidemics leads to lumpy skin disease infection now in Egypt is an endemic. So, all of the latter act as a risk factor, maintain and continue occurrence of the disease in a region. Disease is a Latin word. Morbus means absence of health signs. This picture of a calf infected by warts as a viral disease of skin in ruminant. This means that absence of the health signs of skin and appear of a morbus or a disease naming warts. Disease, Latin words of morbus, in humans means that a physiological or psychological dysfunction. This picture showing high temperature with flu-like. That means that this person feel that he is catching corona, and so psychological dysfunction in his brain taking place through his side. The timeline of natural history of disease. Natural history of disease refers to the progression of a disease processes in an individual or animals over a time, in the absence of treatment or proper control. For example, untreated infection with HIV causes a spectrum of clinical problems beginning at the time of seroconversion, primary HIV, and terminating with AIDS disease and usually deaths. It is now recognized that it takes 10 years or more for AIDS to develop after the first seroconversion case. The other example is the COVID-19 pandemic. Appearance of new strain of the coronavirus as SARS-CoV-2 in Wuhan zone in China at late of November and the beginning of December 2018, and due to lack of knowledge about the characterization of this virus, it make local epidemic in that country. But due to lack of informations, economical and political reasons, delaying in announcement about the infection by WHO as pandemic of corona caused the global disaster nowadays. So between the beginning and the primary corona case and the pandemic, it is a time. So the world will suffer for several years from now from the reflection of SARS-CoV-2. Factors affect on the natural history of disease. Biological factor, biological and genetic determinants of health such as age, sex, tuberculosis status, brucellosis status, HIV status, family history, breed history of the disease affect occurrence and health, treatment and or control of every disease. Geographical factor as an effect part on the natural history of disease. Geographical location affect through spatial location plays a very important role in shape of environment as well as other health effects. For examples, locating healthcare facilities in rich country give more support to personalities than poor countries. Presence of veterinary research and high tech give more support for animal productivity. Nutritional factors that affect health as examples of deficiencies or excess of vitamins, increases or decreases of diet or animal feeds will lead to eating disorders, as it says. Meteorological factors affect on the natural history of the disease through whether either low or high temperature, humidity either low or high will affect in the occurrence and act as an important risk factors for occurrence, control, treatment of different diseases. Cultural factor including motivational culture, cultural performance, cultural language, cultural education, religious ethics and values, and social organization affect dramatically by increasing or decreasing occurrence of different diseases. Rest of factors affecting on the natural history of the disease. Religious and religious groups all over the world act as either supportive or dissupportive to health of the man and health of animals. according to their thoughts, so trying to change the thoughts of them to help progression of health of man and animals. Behavioral factor. Several behaviors that exist a strong influence on the health of animals or human, including accepting vaccination of animal, visiting to different veterinarians or physicians for treatment, tobacco addiction, alcohol consumption, physical activity. All of them are behavioral thoughts of persons. Economic factor play an important role between rich countries and poor countries, and this is noted in the last epidemic of corona. In rich countries such as Germany, the mortality rate reached to 0.1%, but in poor countries it may reach to 7 and 6%. So economic level act as an important factor for natural history of the disease. Historical development of public health and infectious diseases for animals and human, which began in ancient time, emphasizes how various concepts have evolved as a measure like of leprosy and quarantine value. This is noted in African poor countries for control of different diseases such as Ebola, malaria, contagious bovine pleuropneumonia, and lumpy skin disease. Political factors and for governmental policies and administrative practices can have a great impact on health and veterinary control and the treatment program through increasing the budget and support for proper control and treatment of different diseases in the populations. Technological factors play a role in medication control theories about diseases, and this is found between 18th, 19th, 20th, and the 21st century that global cooperation is still need for support between high-tech countries and low-tech countries as control of a disease in its primary origin, treatment of a disease in its primary origin will help whole world from disasters such as influenza pandemic at 1817 or influenza pandemic at 1918 and corona pandemic at 2020. This diagram will be used to explain the process of timeline of natural history of the disease. The process began with appropriate exposure or by accumulation of different risk factors that sufficient for the disease process to begin in a susceptible host. For an infectious disease, the exposure is a pathogenic microorganism. For cancer, the exposure may be tobacco smoke or another determinant that promotes a process such as estrogen for endometrial cancer. So, a stage of susceptibility is explain the availability of susceptible host for occurrence and affected by different risk factors. The other stage begins with exposure to the different examples as smoke or pathogenic microorganism or hormonal increases. After the disease process have been triggered, pathological changes then occur, but without appearance of any signs or symptoms of the disease. This stage is the stage of subclinical disease. It extends from the time of exposure until onset of the symptoms. This time is usually called the incubation period for infectious diseases and latency for chronic diseases. Incubation period, as an example, for equine influenza take about 2 weeks, and for brucellosis as a chronic disease take about 1.5 or 2 years. For cancers in man, it may be lifelong, reach to 50, 40, or 60 years to appear. During this stage, the disease is said to be asymptomatic, no symptoms or inapparent. This period may be as brief as a second for hypersensitivity and toxic reaction, to as long as decades for certain chronic disease. This example is clear with Streptococcus equi infection. At the end of the disease, there is hypersensitivity occur to the animal. Even for a single disease, the characteristic incubation period has a range. For human, typical incubation period for hepatitis A is long as 7 weeks. Although the disease is not apparent during the incubation period, some pathological changes occur in infected or affected animal or person and could be detected only with laboratory radiology or screening methods. Most screening programs attempted to identify the disease process during this phase of its natural history, such as single intradermal test for detection of tuberculous animal, Rose-Bengal test for detection of brucellosed animals. Since intervention at this early stage is likely to be more effective than treatment given after the disease has progressed, or control intervention at these early stages after detection of positive cases of brucellosis or positive cases of tuberculosis is more efficient than still the disease make a mess in its place. The onset of symptoms marks the transition from subclinical to clinical disease. Most diagnoses are more made during the stage of clinical diseases. In some animals and people, however, the disease process may never progress to clinical apparent illness. In others, the disease process may result in illness, such as during tuberculosis, the disease process and affect most of the organs in the animal. It take about 2 years. Cancers in human take more than 40 to 60 years to appear. So the disease here is clinically inapparent, but the pathological changes occur inside the animal or person. The disease processes may result in illness that ranges from mild to severe or fatal cases. This range is called the spectrum of the disease. Ultimately, the disease process ends either in recovery or disability or deaths. For an infectious agent, infectivity refers to the proportion of exposed animals or persons who become infected. Pathogenicity refers to the proportion of infected individuals, either animal or persons, who develop clinically apparent disease. Virulence refers to the proportion of clinically apparent cases that be severe or fatal. Because a spectrum of disease can include asymptomatic and mild cases, the cases of illness diagnosed by clinicians or veterinarians in the community often represent only the tip of iceberg. Many additional cases may be too early to diagnosis or may never progress to the clinical stage. Unfortunately, affected persons or animals with apparent or undiagnosed infections may nonetheless be able to transmit infection to others. Such persons who are infectious but have subclinical disease or inapparent infection, persons with coronavirus can transmit the virus for about 37 days. Measles and hepatitis A and several other diseases become infected within few days. Tuberculosis take long time until opening of the sequestrum in the lung of affected animal, and this may take 1 year or more. Appearance of brucellosis and infection to another animals, it take the time of animal to come in puberty and then pregnant, by means that appearance of the brucella organism again after its entrance in the animal, it take about 2 years. However, carriers may also be persons or animals who appear to have recovered from their clinical disease but remain infective. The challenge to public health and to veterinary medicine workers is that their carriers as coronavirus infection in the medical staff is the higher than the other person. Brucellosis between veterinarians is higher than the normal persons in the community. Work in tuberculosis farm is more dangerous for veterinarians than work in tuberculosis hospital. We explained before in the chart of timeline of natural history of the disease, subclinical disease occur by exposure of susceptible hosts to the disease agents without showing any clinical symptoms, but showing pathological changes and physiological changes, and this could be detected only by diagnostic tests. An excellent example for subclinical disease is the SARS-CoV-2 subclinical disease in a person where the virus present in the bloodstream of patients during incubation period and viral discharges for 48 hours before symptoms appear. Another important example in veterinary medicine is the rabies disease, where viral discharges in the saliva for a week before clinical symptoms appearance in animals. Seasonal diseases are the diseases that occur or appear in a season more than others due to different temperature, humidity, air, winds, and this related to certain season with periodic fluctuation in its incidence. Examples in animals are blood parasites such as babesiosis, filariasis, rickettsial diseases such as anaplasmosis, foot and mouth disease, lumpy skin disease, and etc. In human, measles, diphtheria, chickenpox, rotavirus, malaria are an excellent examples. A better understanding of seasonal infectious disease outbreak and persistence is likely to result in a better understanding of the optimal control strategies. However, it's also important to consider the interaction of control strategies themselves with seasonal dynamics. In the case of plus vaccination, we have shown the importance of considering the limiting of immunization days. These considerations extend to programs with periodic mass administration of vaccines, such as those for foot and mouth diseases, as well as lumpy skin diseases. Also, application programs for massive administration of antibiotics for seasonal infections of ocular chlamydia. In the case, however, the intervention results in abrupt periodic changes in the number of infected or diseased animals rather than susceptible individuals or animals, and the optimal time for treatment or control may differ from that for proper vaccination or treatment that linked to the optimal season. This is an excellent example for seasonal diseases, babesiosis, which give the clinical symptoms as red urine, emaciation, yellow coloration of mucous membrane of the eye and vagina. Babesiosis notes in temperate and subtemperate area occurrence in the season of tick and other hematogenous insects become increase in the number. This usually occurs in the early spring and summer. So, babesiosis usually linked to summer or spring seasons. An excellent example for human seasonal disease is occurrence of flu in autumn and winter. So, vaccination against them begin during September. Factors affecting on-periodic fluctuation of seasonal diseases. There are 5 factors. Number 1, it changes in the density of the host. Number 2, management plans. Number 3, survival of infectious agents. Number 4, vector dynamics. And the last one is the ecological factors. It changes in the density of the host. Overpopulation of different animals or human in certain place will lead to occurrence of diseases. During school time and due to density of children in the same place, chickenpox, measles, and maybe tuberculosis are diseases of overpopulation. In animals, pasteurellosis, bovine respiratory disease complex, E. coli enteritis rate increase, and tuberculosis are a diseases of overpopulation. Management plans play an important role in seasonal diseases, where adequate space and plenty forage for dairy cattle increase their milk productivity. Also, application of different hygienic conditions and prevent of mastitis will increase in adequate space and adequate number of cattle husbandry. Survival of infectious agent by means that how long does the microbes last in the nature. The examples here is for SARS-CoV-2 survive on the surfaces. As aerosol in the air, it survived for about 3 hours. On the copper surfaces, it survived for 4 hours. On cardboard, it lives for 24 hours. On plastic sheets, it survives for 2 to 3 days. On a stainless steel sheet, it survives for 2 to 3 days. And the long the presence of any microorganism in the nature means that increased number of animals or humans that take the infection and vice versa. Vector dynamics. The excellent example is transmission cycle of equine encephalitis viruses through and by insect vector as Culex mosquitoes, where the reservoir hosts are birds, and it take and give the virus to the mosquito through insect blood meal. This insect blood meal, as a hematogenous insect, accidentally give the virus to the human and the equines in the same place. So, the time of spreading of mosquitoes during spring, during summer, beside pools of water and rivers, and in any hygienic places, will increase the rate of equine encephalitis infection. Ecological factors. Life cycle of liver flock is an excellent example for the effect of ecological factor in distribution of fascioliasis, where metacercaria present on the grasses that taken by the cattle, then the eggs shed 8 to 12 weeks after infection in pools of water, humid soil, and on the shore of rivers. These eggs will change it in the water into miracidium, and then in the snail it changed into cercaria, and then on the grasses again it will change it into metacercaria. So presence of pools of water, rivers, or high humid areas, as well as presence of the snail, act as ecologically risk factors for fascioliasis. An excellent example for ecological factor is the affection of pollution on animal and human health, where pollution leads to reproductive defect, respiratory defect, neurological effects, birth defects, cancers, and other defects and health hazards in the areas of pollution. Ecological factor can also be explained through this schematic drawing of endemic and epidemic transmission cycles of Eastern equine viral encephalitis, Western equine viral encephalitis, and Venezuelan equine encephalitis viruses, as the dominant here is mosquitoes as well as rats and wild animals. So mosquitoes, birds, and wild animals act as reservoirs and transmitted vector of the virus accidentally to human and equines that live in the same place. So any place with these vectors and reservoirs will be suspicious for occurrence of latter diseases either in man or equine. Series of principles of prevention and control of infectious diseases to be continued.